In the case of Moyamoya disease, a distinction can be made between patients with a chronic or an acute course of the disease. Patients with a chronic course have probably had the disease for many years and have not had any symptoms so far due to sufficient collateral circulation. Patients with an acute development of the disease have a change, a slow closure of the blood vessels over several months, which leads to the patients developing acute symptoms because they have not yet formed sufficient collaterals. Possible disease activity can be shown in the MRI with special high-resolution sequences. Contrast medium must be administered, and the vessel wall can be shown in a sub-millimeter range. Then you can see possible disease activity in the sense of contrast medium uptake. In Tübingen, we were the first working group in the world to be able to show a chronological change in disease activity in the sense of increasing and decreasing contrast medium uptake of the vessel wall. As a result, the vessel will slowly occlude over the course of several months. It is very important that this disease activity is recognized. This opens up completely new possibilities for detecting the mechanisms that cause the disease. All previous studies were based on the assumption that Moyamoya disease is in a stable stage. It was not previously known that there is a dynamic progression in which the disease progresses and can then turn into a chronic state in some patients. Furthermore, disease activity is a very important marker for us in risk stratification in order to evaluate the risk of new strokes. Patients who are already in a chronic state have a lower overall risk of stroke because the body has already been able to form sufficient collaterals. Patients who are in an active disease stage, that is, the disease is actively progressing, have an increased risk profile for suffering new strokes because the body has not yet formed sufficient collaterals. These findings open completely new possibilities for understanding the disease processes in Moyamoya patients, since laboratory and blood specimen findings can now also be correlated with the activity of the disease for the first time. In our center, all patients routinely receive the special sequences during MRI examinations so that we can identify the current state of disease activity.